Hello everyone, welcome to today's session. If you are new to our channel, please subscribe it for the daily videos. Tarsal bones. Tarsals, a set of 7 irregularly shaped bones. They are situated proximally in the foot in the ankle area. Tarsals. The tarsal bones of the foot are organized into 3 rows: proximal, intermediate and distal. Proximal group, which is hind foot. The proximal tarsal bones are the talus and calcaneus. The talus. Talus is the most superior of the tarsal bones. It transmits the weight of the entire body to the foot. It has 3 articulations: superiorly, the ankle joint, between the talus and the bones of the leg, the tibia and fibula; inferiorly, subtalar joint, between the talus and calcaneus; and anteriorly, talonavicular joint, between the talus and the navicular. The main function of the talus is to transmit forces from the tibia to the heel bone, that is known as calcaneus. It is wider anteriorly compared to posteriorly, which provide additional stability to the ankle. No muscles originate from or insert onto it. This means there is a high risk of avascular necrosis as the vascular supply is dependent on fascial structures. The calcaneus. Calcaneus is the largest tarsal bone, lies underneath the talus where it constitutes the heel. It has 2 articulations: superiorly, subtalar, that is talocalcaneal joint, between the calcaneus and the talus; anteriorly, calcaneo-cuboid joint, between the calcaneus and the cuboid. It protrudes posteriorly and takes the weight of the body as the heel hits the ground when walking. Intermediate group, midfoot. The intermediate row of tarsal bones contains 1 bone, the navicular, given its name because it is shaped like a boat. Positioned medially, it articulates with the talus posteriorly, all 3 cuneiform bones anteriorly, and the cuboid bone laterally. On the plantar surface of the navicular, there is a tuberosity for the attachment of the part of the tibialis posterior tendon. Distal group. In the distal row, there are 4 tarsal bones, the cuboid and the 3 cuneiforms. These bones articulate with the metatarsals of the foot. The cuboid is furthest lateral, lying anterior to the calcaneus and behind the 4th and 5th metatarsals. Fractures of the talus and calcaneus. They are the most frequently fractured of all the tarsal bones. Talus. Talar fractures most commonly occur in the neck of the talus, that is 50%, but can occur in the talar body or lateral process, with those in the talar head being the least common. Neck fractures. Typically, high energy injuries caused by excessive dorsiflexion of the foot. The neck of the talus is pushed against the tibia. In this type of fracture, the blood supply to the talus may be disturbed, leading to avascular necrosis of the bone. Body fractures usually occur from jumping from a height. Calcaneus. The calcaneus is often fractured as a result of axial loading, typically from a fall from the height. These patients should be assessed for associated injuries such as fractures of the lumbar spine or lower limb. The bone can break into several pieces, known as a comminuted fracture. Upon X-ray, the calcaneus will appear shorter and wider. Even after treatment, the calcaneal fracture can cause further problems. Thank you. Have a nice day.